All right, it is 1 p.m. Central Time. I have started recording of this webinar, and I wanted to just welcome everyone to our very first Healthy Brain webinar of our Healthy Brain webinar series. My name is Jasmina Sisirak. I will be your host today. I wanted to just briefly introduce Beth Marks, Matthew Janicki, Catherine Service, and Valerie Gress, who are your main presenters today. They will introduce themselves a little bit more for the sake of timing. Today, we are going to be presenting our new CDC-funded Healthy Brain Initiative for people with intellectual and developmental disabilities, and we will be introducing our partners for this 5-year grant. We would like your input about brain health and the types of resources that would be helpful to you. And we really would love to hear your questions and comments that you have as we go through our presentation today. So think about the following questions and then put them in a feedback or a chat box or a question and answer box. Thinking about, do you have any issues and needs for brain health? What types of brain health resources and information would be useful when working with people with intellectual and developmental disabilities and their caregivers? And just anything that you would like to hear about in the future. We really are seeking feedback from you so we can develop further webinars and be a useful resource for you for the next 5 years. A little bit of housekeeping. Continuing education credits are not offered for these webinars. We do send a thank you email or thank you for attending email. So sometimes people have used that as their proof of attendance for these webinars. And then we will be placing this recording and any materials on our Health Matters Program YouTube channel. And I will send out an email about that too in the thank you email. And then again, please use chat box for comments and questions. The webinars are presented by the Health Matters Program at the Department of Disability and Human Development at the College of Applied Health Sciences at the University of Illinois at Chicago, in partnership with National Task Group on Intellectual Disabilities and Dementia Practices and Engage Illinois HRSA Geriatric Workforce Enhancement Program. It is funded by the Centers for Disease Control and Prevention, and contents are solely the responsibility of the authors of this webinar and do not represent the official views of the CDC. All right, with all of that, I will pass the presentation to our first presenter, Beth Marks. Beth?
All right, Jasmina, can you hear me okay?
Yes, thank you.
And are you okay advancing?
Oh, I just passed the presentation, but I can advance if you want. That's fine.
Okay, that would be awesome. Thank you.
And Lynn, the slides will be available after the presentation. They will be posted along with the recording on our YouTube channel. So you will have them available. And just consider this presentation as a large snack of the things that are to come related to Healthy Brain Initiative and people with intellectual and developmental disabilities. So go ahead, Beth.
Okay. So welcome everyone. Jasmina told me snack earlier today, and I asked if that would be, in humor, if that would be cookies or crackers, and she ignored me. Thank you. I see many of our friends, longtime participants with our webinars on the call. It's great to see your names again, and we very much appreciate you coming back. This is what we've been doing during our brief intermission with our webinar, getting our Healthy Brain Initiative going. And one of the first slides I want to mention is Alzheimer's disease and other dementia. That's the focus of one of the foci of our Healthy Brain Initiative. About 6% of 180,000 older people with IDD will experience some form of Alzheimer's disease and other related dementia or unrelated dementia, as the case may be, after the age of 60. And this increases with age. One of the things that we addressed in our proposal to CDC is a common misperception that dementia is really not a natural course for people with intellectual and developmental disabilities. And increasingly, particularly the last couple of years, there's more and more research coming out showing that people in the general population can reduce the risk of cognitive decline by making key lifestyle changes, just as we see with other chronic conditions. So really focusing on physical activity, social engagement, good nutrition, and good heart health. Next slide, please. Oh, and then before, just to go back a second, and then they talk about these 6 pillars along with the social interaction, but looking at the medical health, sleep relaxation, and mental fitness. Okay, next slide. And as Jasmina said, our National Healthy Brain Initiative Collaborative is a part of CDC's Healthy Brain Initiative. Our partnership at UIC consists of the HealthMatters Program, so Jasmina and myself, and the National Task Group on Intellectual Disabilities and Dementia Practices with Matt Janicki and Kathy Service, longtime colleagues and friends, and delighted to have an opportunity to connect with them on this important area. And then our newest partner is with Valerie Gress, and Valerie heads up the GWEP at University of Illinois at Chicago Geriatric Workforce program, and her particular program, GWEP, is Engage Illinois. It's funded through HRSA, and as I said, Geriatric Workforce Enhancement Program. Valerie has been a delight to work with, and so you will get to meet her a little later on. I know many of you have probably seen Matt Janicki's work and Kathy Service. So our primary aim is to support population with high burden of Alzheimer's disease and other dementia. And the 3 areas are education training programs and resources for healthcare, public health professionals, and caregivers. So that covers our range of participants that we've had and met over the years with the HealthMatters Program. Workforce development to expand and scale up the Healthy Brain Initiative roadmap, and that's something we're developing over the 5-year project. So we started the end of September, and we will go of 2020. We will go through September of 2025. And then the third is developing the policies and partnerships to implement public health strategies to promote brain health, and that extends from a local level to a national level. And next slide. So one of our models, and this really ties in with the HealthMatters program that we've been doing since 1998, is changing expectations that health promotion, disease prevention works well for people with developmental disabilities as it does the general population. And we are one of 3 component B projects with the CDC Centers for Disease Control National Healthy 5-Year Brain Initiative addressing dementia among groups with high burden of Alzheimer's disease and other dementia. You can see on the image there's the 3 what we call component B. So UIC, the second is Us Against Alzheimer's, and then the third is International Association for Indigenous Aging. And that includes Native American, Alaskan Native, and Hawaiian Native. So they have a very large task in front of them, very diverse group. Us Against Alzheimer's is primarily focused with Latinx and African American in the US. And then Alzheimer's Association is what we call our component A, the backbone organization that sort of pulling together our collaborative, and that includes the 3 centers on excellence. One is in New York, one is in Minnesota, and I just blanked a second. Maybe Matt will remember when he talked. The third COA Center on Excellence. We have all kind of had a ginormous, particularly myself, sort of uptake of figuring out who the players are and who's doing what. But nonetheless, we're very excited to be a part of this project on an early end because for once people with developmental disabilities were not sort of at the end. And I would also add with Matt Janicki is a key person for making this happen and even having people with IDD be part of this announcement. So every call I'm on with Matt, I'm always extremely gracious and happy that he has paved this way for several decades. Our collaborators, we have a theme from WHO of really having health as an everyday resource where people live, learn, work, play, and play. And so when we look at our collaborators, we extend, so Project Search has been a major collaborator with us through the Ohio DD Council initiative that we've been working on, to local health department, to Down syndrome organization, specific developmental disabilities, to the Illinois DD Council, to the Gallisano Developmental Disability Nursing group that was recently funded about 2 years ago. So this is just a sort of a general overview, not all of our collaborators, but just to highlight that we are trying to reach people, again, where people live, learn, work, play, and play. And next slide. This slide, as I was telling Valerie, it took us a little while to really, no pun intended, wrap our brains around the topic. And one of the first things that we really struggled with, which I know will not be surprising to many of you, was just the definition of brain health. And a lot of the definitions out there inherently were exclusionary of people with intellectual disabilities. So our definition is really looking at promoting brain health for people with IDD and their support to enable people to realize their ability, manage life situation, and optimize their cognitive, emotional, psychological, and behavioral functioning. And specifically, really looking at the interconnected social determinants of health that can impact both brain development from preconception through the end of life. So even if people acquire Alzheimer's disease or any other dementia, that there's still the theme of healthy lifestyle matters even more. So just like if you acquire a heart condition, we talk about healthy lifestyle. It's not uncommon if you acquire Alzheimer's disease or a related dementia that all of a sudden we stop talking about healthy lifestyle and we think about, where should people go? And so we're trying to change that perception of really thinking about healthy brain initiative across the lifespan, whether you acquire additional disabilities like Alzheimer's disease, and really focus on education, policy, and workforce development to increase engagement in physical activity, food, and having options for good food and nutrition, medical health, so making sure that we have good cholesterol numbers, our blood sugars are okay, we have a healthy heart rate, and so ensuring that we are up to speed with making sure that we can sleep, that relaxation is a part of our daily life, mental fitness, and then particularly for people with IDD is the social connectivity. And next slide. Okay. Oh, okay. And just a note, as we've heard, coming hopefully on a better side of COVID-19, one of the things that we have seen, and I know many of you know this, but we did really see sort of people with IDD disproportionately impacted by COVID, and that goes back to the previous slide regarding social determinants of health, and really starting to focus on those social determinants and making sure that people have the opportunity to what we call those 6 pillars of healthy lifestyle. But we did see people in congregate care settings have a higher spread of COVID-19. People with IDD were more likely to die than those without, higher death rates of people with IDD ages from 0 to 74, After age 74 and older, it was about the same. We don't have a lot of data, but this is just pulling from the low data that we have. And then we saw a higher prevalence of comorbid circulatory, respiratory, and endocrine diseases across all age groups, including diabetes. And next slide. And so one of the things we're building is a community of practice and trying to create a one-stop space. As Jasmina said, we really want all of your input, and we really do read all your emails, any calls we get, and value your input, because without you, we wouldn't be able to get the work developed and disseminated. So we want to increase awareness of Alzheimer's disease and dementia, that it is something that healthy lifestyle can address, and there are ways that we can support people to age in place around various public health strategies to improve quality of life. And then the third part that I did not mention that's the focus of the Healthy Brain Initiative is caregiver health and wellness. And I know over the years we've talked about health and wellness for direct support staff, but this is actually a component of this 5-year grant. So we do want to really promote the theme that caregivers matter. We want to improve health equity for people experiencing Alzheimer's disease and dementia, and then enhance opportunity for people with disabilities to actively engage in lifestyle goals, preferences, and options. And next slide. Here's just kind of as Jasmina said, a snack of what we will be doing over the 5 years. Is we're going to be upgrading our HealthMatters website to have healthy brain messaging. Today we are launching the webinar series, and then I know quite a few of you participated. We had a small amount of internal funding from UIC to convert our HealthMatters program to a virtual coach last year. Jasmina did an amazing job, along with our colleague in New Mexico, Jean Desjardins. And then the second thing is Engage Illinois with Valerie. She has a phenomenally robust set of modules, CEUs, and she is working with us to include people with IDD across her modules. She will cover that more in her overview. And then she has a really cool dementia guide expert app that she's also going to be including caregivers supporting people with IDD. And then Matt and Kathy's work with the National Task Group on dementia-capable care for adults with IDD, and then the Healthy Brain curriculum, which includes an information package, nutritional guideline, memory care home solution, project search, employment transition. As I said, we are looking at healthy brain across the whole lifespan, brain health screening, and education and advocacy package. And then the next slide. The virtual coach, just wanted to do a brief update. We are still, it's gone quite well. We are still bringing health promotion programming to your community. And I think we're still working through sort of the next steps with how we were doing Health Matters previously to what we love about the virtual coach project now. We reached 53 organizations in 23 states. 41 organizations continue both training and instructing. Organizations that started out with virtual and kept the virtual were much more likely to keep going. They didn't have the interruption. We were able to include 274 staff, reaching projected around 1,700 people with IDD. At the moment, we are adding extension models to include healthy brain component, and then we also want to extend all the lessons to really think about where people live, learn, play, and work. And then as part of the Healthy Brain Initiative, we will be offering the virtual coach 2 times a year. So stay in touch, because those will also be at no cost. And then next slide.
And Beth, this is Jasmina. I just wanted to go back and just briefly connect, for those of you who are not familiar with our Health Matters program, It's a 12-week exercise and health education program that really is addressing what Healthy Brain Initiative activities are talking about, with learning more, get moving, stay connected, eating right, and taking charge. So we're really able to bring a behavior change health promotion program for free to community-based organizations or to communities for the next 5 years. And it's a very exciting sort of development. We will be announcing more information about it next month, and I will most likely even have an informational webinar for those of you who are interested in joining the 53 community-based organizations that are already participating. Beth, did you have anything else, or should I pass the presentation to Valerie?
No, thank you. That was thank you for adding that information and pass the torch to Valerie.
Valerie, do you want me to advance your slides, or do you want to have the opportunity to advance them?
No, you can go ahead. I'll let you know.
Okay, sounds good.
Hi, everyone. I'm Dr. Valerie Gross, and I'm a clinical professor at University of Illinois at Chicago in the College of Nursing. I'm a geriatrician, and I'm also a dementia researcher. And as Beth mentioned, I'm the PI, principal investigator, for the Geriatric Workforce Enhancement Program that was awarded to UIC. And my co-PI is Dr. Mamouna Hesnain, and she's in the College of Family Medicine and Community Medicine. And as Beth mentioned, this is a HRSA funded, federally funded project. Next slide, please. So I'm excited to be partnering with this initiative because the Engage Illinois GWEP Award that we have, our program, is an excellent fit and for this collaboration. And we have a shared vision to raise the awareness of dementia and promote a dementia-positive approach to managing persons with dementia, and also meeting the unique needs of the different populations that do experience dementia. As you can see in this figure, Engage Illinois has 9 programs under 3 primary objectives, and we're going to be focusing on the age-friendly systems and dementia-friendly programs that Engage has implemented. So first, we're going to start with a program, and I'm just going to go over these programs briefly to give you an overview of them, and you can envision how they are a good fit with the initiative, the Healthy Brain Initiative. So next slide, please. We'll talk about vertical independent villages. Okay, our vertical independent villages is a collaboration that we have with the City of Chicago Age-Friendly Commission. We partnered with them to establish a program that trains building management staff in identifying their older adult residents that may be having problems with memory or may already have a dementia diagnosis. So we work with the building management staff because building management staff, they're the boots on the ground, and they're the people that are there 24/7. They know their residents very well. And although we don't expect them to be clinicians or to be medical professionals, but because they do know their residents so well, they have the ability to identify subtle changes that the residents may be going through and identify that, and then they can make a referral to the City of Chicago hotline phone that's been established, and they can have their residents assessed for memory and cognitive changes. Next slide, please. Next slide. I think you skipped one. Can you go back just one? Sorry. Okay, so this is the impact of the program. So we have trained hundreds of building management staff, and those building management staff engage with literally thousands of older adults in their building. Some of the senior high-rise buildings have hundreds of residents, hundreds of apartments, so the impact is huge. Because of COVID, we were used to do in-person trainings, and now we transitioned to online webinar trainings, and we conducted a training in November and February, and we have one next month. But our goal is to move forward, and actually we have created a dedicated website with we're going to create online training modules. So then all building management staff can go in at their convenience and take our dementia training modules whenever it's convenient for them. So that's our goal. Next slide, please. Okay, our next program, that's a dementia program, is our dementia-friendly prisons. Next slide. We established a contract with the Illinois Department of Corrections because they were looking for options to train prison correction officers to recognize and address the different healthcare needs of older inmates. The prison population is aging rapidly, and inmates develop chronic conditions at an earlier age. So, and also inmates that have dementia, they were experiencing exploitation from other prisoners, and they were also experiencing unjustified disciplinary actions from the prison correction officers because the correction officers didn't understand why they were behaving differently and why they couldn't comply with simple instructions. And the reason was that many of them have dementia, so they were incapable of doing that. So they would face disciplinary actions. So our program and our partnership with the Illinois Department of Corrections is to go into prisons and train the prison staff on how to communicate better, how to manage inmates who have dementia, and to create an environment where it's dementia positive. And the inmates are respected, and there's an understanding of how they should be better managing their inmates with dementia. We have, because of COVID, prisons are on lockdown still, so we are transitioning to virtual training for the correction officers. Next slide, please. So our third program that Beth mentioned also, Engage Illinois has used technology to further expand our programs. And one of the things that we did was create a Dementia Guide Expert mobile app. So our mobile app is called Dementia Guide Expert. It's available for free. If you have an iOS phone device, you can download it on the Apple iTunes. And if you have an Android device, it's available for free at Google Play. The app is available in English. We recently have made a Spanish version, and we've also made a Korean version. To date, our app has been downloaded and viewed over 66,000 times in 12 different countries. And one of the reasons is our approach with the app was to increase awareness about dementia for the general public and for caregivers of persons with dementia, but it has a lot of practical advice on what is dementia, how do you get diagnosed, what can I expect for living with dementia, what can I expect for the different stages of dementia. And then it also has a lot of links to different national resources, so people are able to access a lot of different resources in one convenient device. So all of the dementia information that you would want, if you're looking for information, is located in one simple mobile app. Next slide, please. So working with Beth and this initiative, we decided that for our next version of the app, that we would transform the app into an accessible, inclusive design. So we've been working all year with our app developers, and as you can see here, we're going to be, our new version of the app when it comes out, will have an accessibility menu. So persons with any types of disability will be able to modify the app for easier use, depending on what their disability is. So we expect this version to come out probably this summer. We are on track with our upgrades. And so we're really excited about it, and we're hoping that the new version will be available this summer 2021. Next slide, please. Okay. And then our next program is an online training program, geriatric training program. Okay. So our online accredited learning, we call it our online accredited learning in interprofessional geriatrics. And this is an online library, and it has 27 online geriatric training modules, and the training modules are available through the Engage Illinois website. So if you go to engageil.com, that's the portal that will take you to our online program. The 27 modules offer free continuing education credits to any licensed professionals. This includes medicine, nursing, pharmacy, occupational therapy, physical therapy, social work, dentistry, I think it's speech therapy. So all different licensed health professionals can get free CEUs for taking the modules. The modules, most of the modules are 30 minutes long. We have a few that are 45 minutes long, so they do award credit for 30 minutes or 45 minutes. And we have multiple modules that address common geriatric conditions. To date, our online program has become really, really popular. We have several universities that have adopted a few of our modules for geriatric training in their health science programs. So to date, we've had over 21,000 modules have been completed, and we've actually had learners, over 6,000 learners. So many learners take more than one module. That's why there's a difference there, but they're very popular. Next slide, please. So this is just a short list of the 27 modules. So the domains for the modules are managing chronic conditions. And under this we include dementia. We do have a module on dementia. We also have a documentary film, a 1-hour documentary film that we made on dementia, and that's available through our website also. And it follows a woman and her caregiver daughter and through the journey of dementia and their experience. And that's available for free on our website also. Our other domain is addresses psychosocial needs. So this could be the dying process or depression and delirium. We also have a module on elder abuse and self-neglect. All of our modules were created by experts in the field. So for our driving safely module, we had an expert from St. Louis who teaches driving safety create the module. For our geriatric pharmacy or medication management, we had experts in pharmacy who created that module. For our elder abuse module on self-neglect, we had experts in social work who created that module. So we use the services of all different experts to help to create the modules. We also have modules on engaging patients and families. This is really important. It includes community-based care. So we have a lot of information on community-based care and resources that are available to patients and families. We also have a module on caregiver burden because it's so important for us to address caregivers. And then we do have the last domain, which is integrating population health. So here we talk about, again, different community services, but most importantly, here we talk about the different cultural aspects of aging, and we have new modules that we developed, and one of them is on the LGBTQ older adult and the particular unique needs of the older adult and how we can better serve the older adult and meet those needs. And now we, in development with Beth Marks is the addressing the needs of the older adult with disabilities. So we are creating an online module that will be available for free that will cover that topic also. So this is, again, this is a really good fit for disseminating this information to a wide audience and also providing this kind of education and training. But for all of our modules, it's always been important that we really take a positive approach. And in particular, with our dementia modules, what's probably different is that our approach is really dementia positive. And that's how we approach the topic and for addressing the needs of this population. And also, it's really important that we, in addition to raising awareness and this positive approach, that we really want to meet the needs of this population, and especially, and we also address the needs of the caregivers, because that's really essential also. So we address, holistically approach this. Next slide, please. So just to summarize, Engage Illinois has assembled an interprofessional team of health experts with a shared vision to enhance the care of very vulnerable populations and to reduce health disparities. And we've done this through strong community partnerships, some of it with government agencies, some of it with healthcare organizations and academic medical centers, and other stakeholders who support programs that can provide the best care for these vulnerable populations. We have created innovative products using technology, whether it's our online training program that's easily accessible for everyone, or it's our mobile app that's also easily accessible. And we use technology for that. And then we have shaped the future healthcare workforce through these online training programs. And our goal is to address the needs of extremely vulnerable populations, including persons with intellectual and developmental disabilities. Thank you very much.
Thank you, Valerie. That was awesome. And as Valerie noted, she's got such tremendous amplification of her product. So it's really, when we wrote the proposal, we had no idea how much of an opportunity this was going to be for us to be able to disseminate and include people with IDD across your various initiatives and out in the community. So terrific presentation, and I'm going to introduce Matthew Janicki. And Matt, go ahead.
Thank you very much, Beth. Pleasure to be on tonight. It was wonderful hearing all the things that Valerie's been doing. Her department has been phenomenal in terms of producing materials that are useful to the field, and we're looking forward to seeing the adaptations into the area of intellectual and developmental disabilities as well. So that's going to be a nice operation over the next 4 years. Let me introduce myself a little bit. Can you just go on to the next slide, folks? It's a pleasure to be working with my colleagues at the University of Illinois. I'm sort of an alumni of the faculty there. I'm actually in Maine, so if you're coming to Illinois to meet with me, I'm not going to be there. But I'm certainly glad to host you in Maine if you're here on the coast. My role is also to co-chair with my colleague, Dr. Seth Keller, the National Task Group on Intellectual Disabilities and Dementia Practices. I have been recently honored by having an appointment for the next 3 years to the Federal Advisory Council on Alzheimer's Research, Care, and Services, which is part of the NAPA Act, which I'll explain in a few minutes. I also involved in this particular project in bringing in my longitudinal study that we've been looking at group homes that are specifically designed for people with intellectual disabilities, and I can give you more information about that at maybe a different date, because there's quite interesting outcomes from that particular study. We've been following people for about 10 years. My history is that I spent most of my career working for New York State government as a director for aging and special populations, and also for planning for the state agency. Next slide, please. Let me introduce a little bit about the NTG. The foundation for the National Task Group really goes back to the federal statute, which is in the center of your slide. The National Alzheimer's Project Act, NAPA as we call it, was signed into law by President Obama in 2011. And it basically set the structure for the past 10 years and often for the next 4 for the country in terms of trying to deal with this issue of Alzheimer's disease and other types of dementias. The Act calls for an annual plan to be developed by the Advisory Council and submitted to both the Secretary of HHS and to Congress, and via that to the President. In terms of what should be done to make things work for people who have Alzheimer's, there's a 3-pronged approach to it. One is looking at research, one is looking at providing support for carers, and the other one is enhancing the workforce in terms of being able to care for individuals. So there's a lot of components in that. The National Task Group basically came into being in 2010, a little before the act was signed, but also consistent with it. Our role has been basically to mirror what's been going on with the Alzheimer's Project Act, and make sure that individuals who have intellectual disabilities and are affected by dementia, as well as their families and other caregivers, are included in any aspects of thinking and planning related to what the country is planning to do around Alzheimer's disease. Currently, we started out as a volunteer group made up of individuals who are volunteering their time and serving on various capacities. We now have migrated up to being a nonprofit organization, and our charters, they're listed on the slide. We've been involved in a number of things. Why, and the question could be also, why are we involved in this project? Well, we're very pleased to be part of it. mainly because our interests coincide in terms of what the CDC is trying to do with Healthy Brain, what our colleagues at HealthMatters and the department, the GWEP at Illinois is doing, and also what we've been doing. Our main mission basically is to try to improve the lives of people who have dementia and try to deal with providing better information to design services that are more adaptable to providing care for people with dementia and to reduce the occurrence of dementia if we can in some way through our efforts. In that course, we have done a number of things. We've been involved with defining best practices that can be used by agencies to deliver services. We were instrumental in developing a first instance educational screening device that helps guide agencies in terms of knowing who may be suspected of having dementia and validating that information. And by the way, that information is very important because in a council meeting that I attended yesterday from the Federal Council, one of the speakers mentioned the impact of screening for people who have dementia, and they realized that through the screening process that about 50% of the individuals who are screened oftentimes then lead to a diagnosis of dementia, and about 30% lead to a diagnosis of mild cognitive impairment. So having a screening in place is very important. The other things that we've been working on and have worked on are producing educational materials that are used for families and persons who have intellectual disabilities, as well as providers of services. And we engage in a number of discussions on public policy as a euphemism for, attempting to shape and thinking and educating people who are involved in administrative aspects and legislative aspects of this issue. And we collaborate with our colleagues in the federal and government and also with national organizations on matters related to intellectual disabilities and dementia. On the slide, you see some images, and those images are some of the products we developed. Our seminal document was the one on the right. It's called the Thinker document. Basically, it was our outline when we first were developed and created as an organization to define what's needed in the United States for providing response to Alzheimer's disease and related dementias for people who have intellectual disabilities, and it outlined a whole scope of services to be looked at and hopefully developed. And we have a target that we're trying to follow over the years to see how much of it's coming true. The other documents are representative of some of the guidelines we've developed and also our screening instrument. All this material is available at the website, which is on the slide as well. It contains a lot of information you can tap into. As I mentioned before, our screening instrument is now available in, I think, around 10 or 12 languages. It's been used around the world and translated. It continues to be used by a number of different organizations to kind of pick up information about an individual who may be suspected of having some changes in their brain health and brain matter, and reporting that to a diagnostician for further assessment and evaluation. Our training activities include the development of a national curriculum on dementia and intellectual disabilities, and we've been producing and running a series of 2- and 3-day training workshops around the country. So they're sort of in abeyance at this point. We're doing them virtually during the pandemic, but we're returning back to that live basis for our workshops in the fall. We also produce webinars. We've been involved very heavily with our family component. We have a number of people on our board who are family members, and they help guide us in terms of developing materials and services and responses to what families need, including, proposing and suggesting legislation. And we do participate on federal activities in terms of the Federal Council, as I mentioned before, and also on the National Disability Council, one of our board members, and we're part of a national consortium on Down syndrome. So our products basically are such that we think that we can adapt them all for use with this particular project, and we're very pleased to be part of it for the next 5 years. Next slide, please. So some of the activities that relate to brain health that we've been involved with, obviously, one of the heavy things that we've been, and Beth mentioned this earlier, the COVID-19 pandemic, we have been collaborating with a number of leading U.S. Down syndrome associations and organizations in developing a series of Q&As, question and answers, and informational resource sheets on COVID-19 and how families and others can respond to it. We were one of the first organizations collectively to produce something back in March and April of last year that helped guide some of the activities that were going on around the country. We had just recently put out an additional version of it about a month ago. And as things are starting to wind down a bit, we're moving in different directions. We've also been working on studying the impact of COVID-19 among providers, which is something that we did last year with a study with colleagues here with Beth and Jasmina in an organization out of Washington. We've created a number of resource guides for family caregivers. We have an interesting one that was developed as part of a federal grant that was given to an organization in Rhode Island a few years ago, a resource guide for families that we are now offering to other organizations to replicate and use in their own geographic areas. We're producing informational materials that enhance supports and services that basically affect lifestyle, which is reflective of brain health, and creating resources for families to better understand dementia and its impact, which is one of the things that we continually find that many people do not have a basic understanding of what dementia is, where it originates from, how it affects people, and what its particular progressions and progress might be. And obviously, we provide trainings for agency personnel on dementia. And now we're being a partner of the HealthMatters Program, CDC grant on brain health, which is an honor to be part of this organization and to work with Beth and Jasmina and Valerie on this project. Let me segue a little bit to this issue of COVID. This is something that's going to have implications for brain health down the road. And over the right-hand corner of the slide, you see an image. It's basically a bibliography that we've developed in conjunction with our colleagues that lists all the different articles that have come out since COVID was found out to be part of the pandemic last year related to intellectual and developmental disabilities. And we've been kind of tracking this stuff and publishing it and updating it routinely. It's on our website. It's on the Health Matters website and the University of Illinois website. So if you need information, any information whatsoever on what's been published, whether it's privately published or in journals or reports from governments, it's in there. What we found basically also that there's been a number of implications for brain health from the pandemic. I listed here on the left side some of the studies that have been reported. We see basically that there's been some effects, mental health effects from social isolation, as you can imagine. All of us have experienced that to some degree. Others have been more vulnerable and experienced more severe effects from it. There's been some reports of brain health issues, mental health issues, and impact on people with intellectual disabilities because of social isolation. During the lockdown periods, which some countries are still experiencing, we've probably passed that stage to some degree, except for maybe 1 or 2 states. Measures show that there's an increase of depressive symptoms and a worsening of functional status in adults with intellectual disabilities. And we also see from research that persons with intellectual disabilities experience massive disruptions in health, home, and community services based on closures and mitigation activities, which increases inequities in healthcare. And anecdotal information also has indicated there are high rates of infection among adults with intellectual disabilities that are unknown. And tests that show positivity for antibodies indicate that people were infected, and even if they weren't noticed in terms of symptoms being not noticed, which may maybe lead to some residual effects. This is something that needs to be studied in much more detail, and we're hoping some of our colleagues will do that. What we're finding now also is that general population research is already reporting some post-infection adverse neurological and psychiatric outcomes, which is something that's going to be worrisome for both not the general population, but also the population of ID. There's a study recently that came out of Oxford University, published in The Lancet, which analyzed records of about 250,000 COVID-19 patients. And they estimated the incidence of being diagnosed with a neurological or mental health disorder following COVID infection was about 34%, which is a high rate. The most common diagnoses after COVID included things like anxiety disorders, mood disorders, substance misuse disorders, and insomnia. Another study out of the UK looked at the chances of developing a psychiatric disorder after recovering. And the published study indicated that about 18% of COVID-19 patients developed a serious mental health issue such as depression, anxiety, or dementia within 3 months of diagnosis. And other studies have shown basically that post-COVID recoveries also lead to commonalities like anxiety, insomnia, depression, and post-traumatic stress disorder. So these are seen in the public, in the general population, and we expect that they'll be seen also in the population of folks that have intellectual disabilities. There's a study being undertaken right now by a group called TR 21RS, which is the Down syndrome 21 research group. And they've been looking at the effects of COVID on people with Down syndrome over the last year. I expect that at this point they'll be migrating over to looking at the residual effects, and we'll need to learn more about it. So kind of summarize what some of the implications are. The short-term reactive effects due to lockdowns, there are effects as well as dramatic changes in routines. We find stress from infection and transfer anxiety from others in the home. The long-term effects are still to be determined, but there may be some residual neurological effects that affect brain health and behavior, what we call the post-COVID stress disorder. So something to be thought about. And I think in the next 3 or 4 years, as we move along with our colleagues in the CDC project, this is going to be an issue that's going to be coming up more and more in terms of brain health. Okay, next slide, please. So what are some of the policy and practice implications of this sort of a big picture perspective? One is certainly strengthening the commitment among stakeholders to lifelong emphasis on health with the commonality of mitigating dementia. That's one of the key issues that we're looking at here. Looking at cross-cutting collaborations across population sectors around intellectual disability and lifelong health focus. Beth alluded to our collegial relationship with a couple of what they call Component B projects. One is dealing with the indigenous population in the United States, and the other is with the Spanish-speaking and Black African population in the United States and others as well. And I think looking at these collaborations across these population sectors around intellectual disability will give us more information about how this condition is seen in the population and also what the effect may be on long life health. Also increasing the understanding of lifelong lifestyle and lived experiences, enhancing later life health and minimization of cognitive impairment, which is some of the things that we need to take a look at. It is our hope, I think CDC's as well, that over the next 5 years, we'll see a lessening of cognitive impairment effects as people realize what the implications are and what they contribute, how they contribute to healthier lifestyles. And also incorporating within practices, policies, and regulatory environments, emphasis on healthy lifestyle and related practices that affect brain health. And this really calls on states to begin to think about how they regulate and suggest practices within the agencies that provide services. And lastly, next to last is enriching the written and oral structures that can serve to inform and enhance positive lifelong practices and for persons with intellectual disability and their families, such as producing technical materials and guidelines, a number of other features which will enable people to understand better the implications of what you do in your early life affects what you do, how it happens to you in your later life. And I think that the last one is incorporating brain health in the national and state dementia plans. Certainly the brain health is incorporated into the federal Alzheimer's plan, but each state, most states I should say, have a state dementia plan, and is hopeful that they also will consider brain health as a key feature. And from our perspective, we hope that that feature will include a focus as well on people who have intellectual and developmental disabilities. Thank you very much.
Thank you, Matt, so much. When I said it was a snack, it's actually turning to be a 4-course meal. I know there's a lot of information, but in the future, we're really planning of parsing out many of these things that you're hearing today and introducing them individually as topics. So if it's overwhelming, I understand, but don't worry, we will be parsing out all of this information and presenting them in different webinars. Kathy, if you can go and do a quick presentation.
Oh boy, okay, I will try.
Thank you. Thank you. And then feel free to start sending questions so I can immediately start asking questions as soon as Kathy is finished with her presentation. Thanks,
Okay.
Kathy.
Thanks, loads. Well, anyway, here I am, and I know the other speakers have really presented a lot and on a macro level. And because I'm a nurse practitioner and I'm practicing as a nurse practitioner, I've been an NP for 42 years with people with intellectual disabilities, and I work for the state of Massachusetts, and now I'm doing some geriatric consultations and doing some work around dementia care for people with intellectual disabilities in Massachusetts. So, and I want to just kind of bring it out to a little bit more of a practical level. Next slide, please. And I'm hoping that you're going to be able, Thank you. Here we go. Here's that connection. Understand the connection between brain health, people with intellectual disabilities with and without dementia. And I really like this image because as it really visually reminds us is that what I've been telling people for years as a nurse practitioner, what's good for your heart is good for your head. So, and also symbolically, I think it really reminds me in terms of our connections with people. I think that this is a great because these are the kinds of activities and what we do that really matters to people with intellectual disability, anybody with dementia actually. Next slide, please. So on this next slide, here's my friend, he's 78, he has an intellectual disability and he's scratching his head because he's always saying, what are you saying, Kathy Service? This is so him. So what I'm trying to say here is that I'm going to be talking a little bit about using what's the connection with brain health and intellectual disabilities and dementia. And I'm going to be using these 5 points to kind of illustrate what I'm talking about. Next slide, please. Okay, so the first point is that I want you to know that when we talk about brain health, we need to take a lifespan approach for everybody. And last year, the Lancet came out with this great article that talked about dementia, specifically on prevention, intervention, and care, and using the life course model. In fact, they cite 12 modifiable risk factors that account for about 40% of worldwide dementias, which could be theoretically either prevented or delayed. And we do know that some changes in the brain may be occurring long before we see outward signs. So risk reduction does matter. And I'm not going to get into a lot of these, but you can see for yourself what those risk factors are. Next slide, please. So I just wanted to kind of call your attention to that. Even with dementia capable care, there is a changing focus in a way with support. Now, before the diagnosis, all the things that we who work in the field in terms of supporting people and working with people, helping them to grow and develop and have all these new opportunities really contribute to good brain health. And then afterwards, I mean, things matter. However, the focus might be a little different on we modify strategies, but we do know that what we are trying to do overall is contribute to well-being. Next slide, please. So I cannot help but stress, people are living with dementia. People can live for years with dementia. And what we need to do is to give them a sense of a good life, a life that they're with well-being. So what can we do? Of course, we pay attention to all those physical well-being, the things on the 6 pillars of health that Beth showed on the first slide. And this little box on the left of the slide is talking about activities. We know ourselves that issues around hydration, physical movement, all of that enables a person who is living with dementia to have a good quality of life. And then, but I can't help to talk about remembering those psychosocial supports. And the picture on the right and Jenny's diary is a way to support people who with intellectual disabilities who are living with dementia. And it goes to show you some of the activities that can be done. That's Jenny and her boyfriend George doing some gardening, and she has dementia, Alzheimer's dementia. So it's looking at what kinds of supports can we put into place. And I wanted to remind people that the connections are the key. I mean, because the connections in our brain are damaged, what we really need to do is optimize those external connections, which means us. So whether we look at direct support professionals, family, housemates, workmates, this is where the connection matters, and we're filling in for where there is damage in the brain. Next slide, please. So brain health is important. It's both person-centered and yet relationship-centered. And tools are really implements, something that is tangible that can help us provide supports. For people living with dementia, Life Story is a powerful and person-centered tool. It gives us information on who is this person, what really matters to them. And this is one tool that you can use anywhere in the life course to try to get information, and it's almost like helping the person write their own memoir. And it benefits us both in terms of the assessment beforehand. I know when I do geriatric assessments, in terms of trying to assess a person for what for changes, I do look at their life story in terms of who is this person and what matters and what's the changes. And then afterwards, in terms of providing dementia-capable care, we can make our care and make the care much more effective. And I've long told people that we have told in terms of relationships that there's no real treatment for people with dementia. And I always say to people, this is wrong. There is treatment. You are the treatment. So how we as care providers or caregivers take care of ourselves truly has an effect on those for whom we're providing care. So as Beth talked about and Valerie talked about and Matt has talked about, you know, there are a lot of resources to help caregivers give them support, issues around stress management. And don't forget, all of those things that we've talked about in terms of physical well-being is really important for you as a caregiver. So I can't help to emphasize that with us. So also, what can we do with outside supports? Can we do this? And don't forget about housemates. I've been involved, I'm a trainer for this program called Dementia Friends. And we are actually, we're looking at it in Massachusetts, and I know there's a group in Ohio who are looking to modify the program to make it more meaningful for people with intellectual disabilities. So this is how we can work with housemates, workmates, people like that. And how do we support us all as a whole in terms of dementia capable care? Next slide, please. I feel like I'm really going forward pretty quickly. So bear with me. I'm not going to get into all the details here, but as you know, knowledge is power. And when I talk about knowledge and power, we know that the next two slides is that it provides you with some tools to support. And from these slides, and Matt talked about, Valerie talked about, we're giving you tools. We're giving you ideas to help support you, to give you a sense of well-being, to give the people we support with intellectual disabilities a sense of well-being, and because they're living with dementia. And one of the things when I think about tools, et cetera, I can't help but think about using them almost as ramps. And we know, in those of us who work with people with physical impairments, we know ramps help people to manage to bridge getting into houses, etc. But I look about these tools as being almost a sort of both a cognitive ramps and also social ramps. This is going to help us enable a person to have a decent life with and be the best that they can be and optimize what they have going for them when they're living with dementia. So I do think that, and I'll end here. I feel like, again, I've been cutting it short, but I wanted to kind of also emphasize what Jasmina is talking about, that these other webinars that we're going to be showing also will kind of emphasize, will kind of elaborate more on some of these ideas that we have that will help people live well with dementia and intellectual disabilities. So, and maybe I like to think I'm dessert in terms of the meal, but I'm not sure. That's it.
You could always be dessert. Thank you so much, Kathy. We have gone a little bit over. I do want to see, there are some questions on nutrition. So please feel free to put in any questions that you have in a chat box. You can always email me and I can connect you with all of these experts and specific questions. We're going to stick around for a few more minutes to really field your questions. I also wanted to mention that our next webinar is on May 25th. And this is basically Brain Health 101 for people with intellectual and developmental disabilities, brain health across the lifespan. So if you have not registered, you have an opportunity to register for the next webinar. So thank you all. For those of you who can stick around, I will start asking some of these questions of our presenters. First of all, we will be, again, sharing the PowerPoints and this recording on our YouTube channel, and everyone who has attended the webinar an email will be sent when those are up, which usually happens within a week. So let me just see some of the questions that have come through. Let's see. Sorry. Okay. So what would be the best approach with families to introduce the screening device? We do case management in Springfield for individuals with intellectual disabilities. I have had the opportunity to be trained as an NTG affiliate regional trainer. So we give this info to our case managers. This information is going to add to the rich knowledge immensely. There's a big concern that I have with our wonderful direct care staff in ISL needing additional information, education, resources on good nutrition and exercise, etc. Anyone who wants to take this answer?
Yeah, Jasmina, I can answer the screening
Okay.
device part of it, I think. The screening was developed for use for families and direct care staff, basically. It's a not a sophisticated device. It doesn't require a doctoral degree and a long-term practice in medicine. It basically, you draw information from the person's record and from your knowledge of the person and from talking with other people who know them, and you fill out a form. And you take that form then to a diagnostician or a clinician, and you say, these are the areas that I think that you need to look at later on. And you can chat about it. You can talk and see if it validates your suspicions that the person may be having some issues, things like that. It's not a sophisticated device, but it's easy to use. It does produce some information, and it's helpful to people who are keen observers of behavior, and they can, jot down the information that's asked for on it.
Well, yeah, and I also think that it's good because if you use it when you notice a change, and when I talk to family members or you validate that something is different here, and that's how you can first preface it, because I think people get nervous around even the notion of dementia. And what I always tell people too is that part of it has to do with change, and it may not be directly, it may be dementia, but there are a lot of other health problems that look and smell like dementia, but they aren't dementia. What this does is help us to kind of focus in. It will facilitate the appointment with the healthcare provider, and it can lead us to figuring out, getting other tests, et cetera, and help to figure out what are we seeing here, what's going on with this person, and ruling out those correctable conditions too, which is key even before you come to the diagnosis of dementia. It's a dementia or Alzheimer's disease is a diagnosis of exclusion. So I think this actually starts the ball rolling, and it just helps us to really focus, because we can go round and round with things.
Thank you. Please, if you have any other questions, feel free to put them in the chat box. I know we're over, so feel free to sign off for those of you who cannot stay. Thank you again for attending the webinar, and we will be chatting in the next couple of weeks. I will be monitoring the chat and question and answer boxes to see if there are any specific questions that come through. Other than that, have a great rest of the day. And presenters, if you can just stick around for a couple of minutes, let me see if there's more questions that come through. We're getting a lot of thank yous, very informative. And for Dr. Janicki from Tracy, I wanted to thank you for all of your research and material. I learned so much from you while pursuing my master's. Thank you again.
Nice to hear. Thank you very much for that.
Thank you, Tracy. All right, I don't think there are any more questions. Again, if you have anything, please contact me. Let me just put my email here again. I'll put it in the chat box as well, and I will be able to direct you. Oh, for Valerie. Valerie, have you worked with anyone who has an intellectual disability in correctional facility? Let me, Valerie is, let me see. I hope, Valerie, I'm unmuting you. Valerie?
Yes.
Okay, good. Phew, I guessed the call-in user.
Okay.
Go ahead.
No, they haven't been identified as that. However, I'm sure that there are persons with intellectual disabilities in prisons. I am sure of that. So but they haven't been identified as that. The challenges that we face, again, as I mentioned earlier, is just with the correction officers is that they just don't have the knowledge or the skills. They haven't been trained to manage people who are demonstrating symptoms of dementia. So that's what our program does. We also work with the medical staff in prisons because many of the medical staff, they also haven't been trained specifically for doing screening for dementias and for creating care plans and management plans. And when we came on board with the prison program, what they were doing for persons that were disruptive or seemed to have a dementia, they would put them in isolation. That was the solution. They would segregate them from the general population so they wouldn't be exploited. But when they put them in isolation, it was like the worst thing they can do because the person, usually when they're with other people, they're cued about what's going on and it's giving them hints about behavior. But when they're in isolation, they become very disorientated and more confused. So the tactic that they were using obviously wasn't working, and it was the wrong tactic. So we're also educating the medical staff. But with the people with IDD, they weren't specifically identified to us, but I'm sure that is part of the prison population. Yes. Thank you.
Thank you, Valerie. All right, it is 2:11. Thank you, everyone. I will stop the recording and have a great rest of the day. And thank you to all the presenters. It was wonderful.